Hi friends. Welcome to Dentistry Love Channel. Exodontia, Introduction and Principles. Let's see. Exodontia, Definition. Methods of extraction. Principles of elevator. Principles of forceps use. Exodontia, extraction of teeth. Exodontia is the painless removal of teeth from their bony alveolar socket with relatively minimum amount of trauma to the investing or surrounding tissues, so that the wound heals without post-operative problems. Methods of extraction includes intra-alveolar extraction, forceps extraction, and trans-alveolar extraction, surgical extraction. Principles of elevator includes lever, wedge, wheel and axle. Lever principle: when used as Class 1 lever, elevator transmits a modest force with a mechanical advantage of a long lever arm and a short effector arm into a small tooth movement against resistance. When a straight elevator is used, a purchase point is made in the interdental bone, which is then used as a fulcrum. Wedge principle: it is used by all elevators initially to push itself into the periodontal ligament. This in turn helps in luxating the tooth from its socket. Wheel and axle principle: it is followed by Cryer elevator and Winder's crossbar elevator, when any root of a multi-rooted tooth is left in its alveolar socket. A Cryer elevator can be placed in the adjacent root empty socket and rotated to fracture the interdental septum and push the root remnant from its socket base. Principles of forceps use: apical pressure results in a minimal movement of the tooth in an apical direction and expansion of the tooth socket by the insertion of the beaks into the PDL space. Secondly, apical pressure with resultant bony expansion pushes the center of rotation more apically, which results in a greater expansion of the socket at the alveolar crest region when the forceps is moved. This prevents fracture of apical segment of the root and more ideal expansion of the socket. Buccal motion results in expansion of the buccal plate, particularly at the crest of the ridge. It is important to remember that this also lends to apical pressure and must not be excess or fracture will occur. Maxillary buccal bone is usually thinner and the palatal bone thicker, thus maxillary teeth are removed primarily by buccal pressure. Lingual motion: similar to the buccal motion but in lingual direction aimed at expanding the lingual crestal bone. Mandibular molars have thick buccal bone and thin lingual bone. Thus they are removed primarily by lingual force. Rotational motion rotates the tooth, which causes some internal expansion of the bone. Teeth with single cervical roots like maxillary incisor and mandibular premolars are most amenable to luxation by this method. Tractional forces, used to deliver the teeth from the socket after adequate bony expansion. This is how principles of forceps used in extraction. Thank you friends. Please do subscribe for more videos.